This is a supplementary video for our work on visualization of human spine biomechanics for spinal surgery. We developed several exploration modes. In the first one, a 3D scene is shown. Here the user can interact with patient-specific anatomy, which was segmented from CT or MRI scans. This allows users to directly evaluate vertebra geometry. Results from the simulation can then be displayed. We use value over time area plots, which we lay out in a way that associates them spatially with their corresponding structure. For instance, here we can see that the computed deformation of vertebral discs is shown over time. So we highlight the spinal discs and assign each its plot. The user can expand these structures so these assignments become clearer. In this 3D scene, all plots remain in anatomically correct positions regardless of the spine model orientation. However, perspective distortion may lead to some unwanted effects, and sometimes it is better to not have a scene interaction or to not have it necessary. For this reason, the expert can switch to a 2D representation. Here we show the plots in a juxtaposition and align them on a shared time axis. We keep their anatomical correspondences as correct as possible, so the expert can, for example, evaluate a force distribution from the spine's top to its bottom. We connect the displayed values with a performed motion. This gets visible when the time slider is used. We show an animation in this smaller window. For example, here we have a slight rightwards head tilt. The window is also interactable. Simultaneously, we indicate the selected time point in the data with this black line, and we also show the quantitative data values at that point. At any point, the user may switch between the representation modes. Settings like time, color map values, spacing between plots, and scaling of plot values, they are all shared across all views. So this is the display for a disk dataset. Now let's have a look at one for our facet joints. Each vertebra has two facets on the upper and lower side to connect to the surrounding structures. What's important here is to make left-right comparisons possible to see if there is an unbalance in load distribution between the two sides. So we display a second stack of plots on the left. Here we mirror the time axis to make use of the symmetry gestalt principle. This means early points in time are closer to the spine axis in the center. So if the plots appear symmetric, the load is equally distributed. In this example, you can see that due to the headband, this side is impacted by an increasing force while the other side is relieved. We also enable a second data set to be displayed in comparison. For instance, here we can load a static data set where the patient is standing still. So this is shown as the gray area, so you can compare the values of the force attributes depending on how much the head is tilted. At any point in exploration, the user can also switch to a reduced depiction we call Simplified View. This allows for an overview that can also be used for ensemble comparisons. We decrease the emphasis on the spine geometry and discretize the color map. The discretization level can be tweaked if desired. This helps to immediately see threshold values and allows us to minimize this depiction while the value range is still readable. This enables the user to compare a multitude of datasets, for example, to contrast the simulated effects of different treatment options. In usual simulation scenarios, what is interesting is the total value of a parameter like force that is affecting a structure. However, for the spine and especially spinal discs, it might be medically relevant to know if a force is impacting the disc from an orthogonal or a skewed direction. Shear forces can be much more harmful than a vertical force distribution. For this reason, we allow the user to display the impact direction of the forces for each target structure. When a large spacing is chosen, the directional glyphs appear. The glyph consists of an arrow along the force direction and this black disc, which is orthogonal to the force. We also render isolines on the vertebral disc model, which are equidistantly spaced and lie all parallel to this force plane. This is an orthogonal force, and here it is skewed to the viewer's left, and here it is skewed towards the viewer. So you can see that due to the redundant mappings of spatial orientation, there is no 3D interaction required to understand the direction. The glyphs are animated according to the selected time steps, so you always see the current impact direction. We also render a trace of the arrow's movement as a fading surface. This allows one-glance assessments of how much the orientation is changing. We hope that the combination of these tools will allow biomechanical simulation researchers to better explore their data, and that it will open up the possibility to introduce spinal mechanics simulations into medical practice.